Hello, everyone. Today I want to introduce you to a program the Birmingham VA Medical Center has launched called the Veterans Response Team, or VRT. The mission is simple: give you, our community first responders, one direct line to VA-specific resources whenever you encounter a veteran in crisis. Behind that one phone call is a dispatch team that's trained on the full range of VA crisis services, including suicide prevention, mental health, homeless programs, veterans justice outreach, substance use, intimate partner violence, peer support, and many more helpful programs. You don't need to know which program fits. That's our job. You just need to make the call. The webpage on this slide has more background if you want to look into it later. So how does this actually work in the field? It starts with one question. Just ask, have you ever served in the U.S. Armed Forces? Or, have you ever served in any branch of the U.S. military? That's it. That single question is the gateway to everything else we're about to cover. It costs you nothing to ask, and it can open the door to real support for someone who's struggling. If they say yes, that tells you two things. First, it means there may be resources available specific to their situation. Second, it's worth being aware that military service can carry unique risk factors, things like combat exposure, moral injury, or transition stress, that may be contributing to what's happening right now. A simple gesture that goes a long way. Thank them for their service. It's a small human moment that can lower the temperature of a tense situation. From there, if it's appropriate and the situation allows, you can ask some follow-up questions. When did you serve? What branch? In what ways, if any, are the issues you're having today related to your service? Are you enrolled or connected to the VA for healthcare or any veteran service organization? Do you have any reservations about seeking support or assistance? You're not conducting an interrogation. You're gathering context that helps us connect them to the right resource. Here's exactly what to do once you've identified a service member or veteran in crisis. Step 1. Call the VA dispatch number 205-212-3963. Step 2. Dispatch will verify eligibility for VA healthcare. To do that, they'll need the individual's full name and social security number. Step 3. Once eligibility is confirmed, dispatch will tell you the appropriate resource to offer the individual to consider. That's the whole process. One call, and you're connected to someone who knows exactly what VA resources are available. I want to spend a minute on something critical. Lethal means safety. The data here is sobering. 82.8% of veteran suicides in 2023 involved a firearm. The firearm suicide rate among veteran men was 70.5% higher than non-veteran men. Among veteran women, it was 168.3% higher than non-veteran women, with a 63% increase from 2001 to 2023. From 2020 to 2023 alone, the share of veteran suicides involving firearms rose by 5.7%. Veterans are more likely to own firearms than non-veterans, 51% versus 40%. And 1 in 3 veteran firearm owners store at least one firearm unlocked and loaded. Why does this matter to you in the field? Because reducing access to lethal means during a crisis, even temporarily, saves lives. It's one of the most effective things we can do in that moment. How you raise this topic matters just as much as raising it at all. Your goal isn't to make someone feel interrogated or worry that you're there to confiscate their firearms. Your goal is to offer voluntary steps that can help keep them or a loved one safe during a crisis. Here's language that works. I want to have a conversation about means safety. Another option is, when someone is struggling in the ways that you are, sometimes suicidal feelings can emerge and escalate rapidly. There are a few steps we routinely recommend for the home to make things safer. Or, guns are the most frequent method of suicide death, and pills are the most frequent method of suicide attempts. So let's start by limiting access to those. Notice the tone, collaborative, not confrontational. Here's a concrete way to bring it up in conversation. Lots of people have guns at home. What some people in your situation have done is store their guns away from home until they're feeling better, or lock them and ask someone they trust to hold on to the keys. If you have guns at home, I'm wondering if you've thought about a strategy like that. And if that's not feasible, try something like this. If temporarily storing them elsewhere is not an option, perhaps we can discuss some alternative ways to keep you safe until you're feeling better. The key is giving them agency. These are choices they're making for their own safety, not restrictions being imposed on them. One more piece of this puzzle, the Veterans Justice Outreach Program, or VJO. The purpose of VJO is to make sure justice-involved veterans get connected to appropriate VA services with the goal of preventing unnecessary criminalization of mental illness and unnecessary incarceration. A justice-involved veteran falls into one of three categories. 1. A veteran in contact with law enforcement who could appropriately be diverted from arrest into mental health or substance abuse treatment. 2. A veteran currently in local jail, either pretrial or serving a sentence. 3. A veteran involved in adjudication or monitoring by a court. If you encounter a veteran in any of these situations, VJO may be able to offer an alternative path, treatment instead of, or alongside, the justice system. Finally, here's who to contact directly. Veterans Response Team Lead. Corporal Rogers, 205-899-2974, contact hours, 6 a.m. to 2 p.m. Veterans Justice Outreach. Quentin Pickett, 205-957-5636. Contact hours 6 a.m. to 4 p.m. And remember, for general VA dispatch and crisis resource connection anytime, the number is 205-212-3963. To sum it up, ask the question, make the call, and use language that gives the person control over their own safety. That's the whole VRT model. You are often the first point of contact a struggling veteran has. This program exists to make sure you're never on your own when that happens.